I'm joined by Dr. Kamila Forkosh Lavan, psychologist, organizational consultant. Thanks for being with us again. We bring you in on some of these topics that, honestly, this struck us around the desk. Look, not problematic, but controversial, perhaps, in some ways. It got us thinking and scratching our heads about this. It lets us not knowing exactly how to feel. I want to say as well, Mattel, did this closely with the U.S. National Down Syndrome Society, who completely, applauded this move, talking about it, the doll being accurately representing someone with Down syndrome, which I think is open for debate, when you look at this doll or any of Barbie's attempts. But it appears to be an effective, or at least, an inclusive, making people with this syndrome feel, the inclusivity here is at least a positive step in that direction.
Exactly. So it's very important to create dolls that are representative of whoever we have in the society, right? And it originally still started, if you remember, way back when with the more racial inclusion, yes? And we know the research that showed on the difference on how girls from different racial backgrounds would see themselves in comparison to the dolls that were available, which were pretty much, blonde and blue-eyed, right? And like you're saying, the waist is still there. So to go a step further and to understand that, look, there are different people in our society, and that's not only okay, that's very important to recognize, and also to inspire them that you within yourself, which is true for all of us, are building yourself as who you are to become better, stronger, more effective within whatever it is that you're working with. And it starts with childhood. Yeah. It starts with the messages that we give them there, right?
And these are young girls primarily, from my own household, playing with Barbies. And I'm left questioning, the issue of the Down syndrome doll aside, are Barbie dolls essentially an effective teaching tool for young girls in society? Does this doll, do these dolls really, achieve or represent the diversity they're aiming for? Or is it, as some say, just perpetuating a lot of the problems still?
Well, again, it's a doll, right? There's many dolls out there in the world, but with the Barbie, I agree with you. Still, a little bit the problem exists where the dimensions of the body, let's say, are still a cookie cutter kind of dimension that's from way back when. That's arguably not attainable or not attainable for everybody. I think that with their awareness, and I don't know if any of them are listening right now to our show, right? But with their awareness that they're already bringing, which is beautiful, and they clearly are trying, one step that would be very, very effective is to look at the forms, at the body shape as well, to make sure that that is somehow representative a little bit better also, not, you know what I'm saying? So that way it is more realistic. That way it is something that people are, in this case, children, will be able to relate to themselves better.
It does. It surprised us in the way that, yes, here's this sort of baseline existing issues with Barbie dolls that on a real fundamental core human anatomy level, they're not representative. Yet here they are pushing these limits of inclusivity, diversity, by taking on, very complex, physically displaying maladies, okay? And this leaves others questioning as well, is this open the door for Barbie to go after other syndromes or maladies that should be emulated in toys at all? Where do you draw the line? Is that a tough question to answer, essentially?
Well, I don't think that there should be a line that should be drawn. Why shouldn't a child that doesn't, have a leg have a toy that also doesn't have a leg? How is this hurting anybody, right? You, as a parent with children that do have legs and don't want to get someone without a leg, you don't have to. You have a choice who you're going to get. But you might also wonder, maybe even if my child is, regularly developing, would I want to get also a child for them a representation of someone that, let's say, has a missing leg? Maybe there is someone in school that they could be friends with or be exposed, and now they will not be acting all kinds of weird and be insulting to this child on a wheelchair or whatever, or with Down syndrome. And to open that conversation, to open the discussion, right, on there are different people out there and how we treat them and what happens. And as you know, often in schools also there is going to be a class where there are children that do need a little bit more assistance physically or otherwise. And actually all the children benefit from that with the appropriate discussion around it. They both benefit, the regularly developing and the children that need a little bit more help when they're like this intertwined. Yes, so it's very, very important to have that discussion. It doesn't hurt anybody. But yes, it would be very interesting to see the next step where, again, this is just something that they somehow didn't discuss of for the proportions of the body, which is why they're trying to do so good, like they missed that, which is kind of funny.
Keep coming back to that. I mean, there was a university study, I think, that said that the rate is 1 in 100,000 chance that a human female will have the body proportions even close to Barbie. So in other words, totally unrealistic. Does something like this, I mean, here it draws my mind in our conversation to this. Is there still pressure on, do you know, I mean, here we are talking about diversity and skin tones, and yes, these are outward issues, but I'm not hearing anyone talk about that. The body image, the body shape there. This is something we've touched on other times as well. There are other obviously societal factors coming into this. A major issue still present in our generation, our daughters essentially.
Yes, of course, not just our daughters. At this point, it already spilled over to a lot of our sons as well.
Yes.
On what is the beauty and what does this mean. And you can literally have a surgery to have a six-pack, right? So now the style of, okay, you being healthy and trying to take care of yourself, okay, you're just going to do a surgery to pretend like you're taking care of yourself. So like that kind of is missing the point, right? So and again, as far as the proportions, literally the proportions of the human body just isn't like, this is not how it's built. So that's I think for me now I'm switching hats for a minute, going back to the organizational work that I do in companies, how often there's a miscommunication on what is it that you're trying to do and how does it actually look like when you produce a product, right? And quality control and things like that. So this is one of those examples where someone somewhere missed, something fell between the chairs.
It feels that way. Look, Dr. Kamila Forkosh Lavan, as always, thanks for being with us. We're sitting around scratching your head over these major issues. We appreciate bringing you in, so thank you.
Thank you so much.